As a registrar, when I first see a patient with GI bleed coming in the evenings, during the weekdays I would fill a GI bleed referral card where it will have the patient's pre-Rockall score at the moment, but we're going to move on to the Blatchford score soon because of the changes and the device from the NICE guidelines. This will be picked up in the morning by the nursing staff, and the patient will have the endoscopy first thing in the morning. From Friday evening onwards until Sunday morning, when a patient comes in with a GI bleed, if they are stable enough, then after stabilization and resuscitation, I would make the referral to the registrar at Lister Hospital, and the patient will get transferred by ambulance to Lister, and from there they will have their endoscopy the following morning, having already filled the endoscopy card request that will go with the patient as well. With regards to transfer of patients between trusts, certainly I've worked in a number of trusts now where they've transferred patients for various reasons, and there are national guidelines on how to make sure that the patient transfer between hospitals is safe. And so when I started writing this paper, I certainly knew that you can have a safe transfer. What hadn't been shown, that patients with GI bleed are also safe to be transferred, and that's what we've shown in this paper. Well, in an ideal world, that's physically possible. I think the trouble is there are always local challenges and differences that might require a greater will to be overcome. But certainly physically it's possible, and from our experience here, we've shown that it's safe to do so. So I think one of the interesting facts that I realized in writing this paper was that even though there isn't a discernible mortality difference between hospitals that have a formalized out-of-hours bleed service and the ones that don't, is that consultants tend to go in out of goodwill in those other hospitals anyway, and so these patients do tend to get their endoscopy out of hours. And I think the problem with that kind of a model is that it's not safe and you may miss a few patients. And therefore having a service overall is much safer and better, as already pointed out by the NICE guidelines as well.